Thank you. All right, we're going to talk about the ZIKA virus and as an emerging problem that we're facing in our nation today. But as we dive in, it seems like every year, every couple of years, we're facing some sorts of epidemia or something like that tend to shake the country and the economy. And most of these conditions, they are coming to us in waves that create initially a bunch of questions and panic. A couple of years ago, last year we had the Ebola. A couple of years prior to that, we had the swine flu. In the Caribbean island, we've been battling the chikungunya and so on, and yellow fever and even more. But all these problems, they're usually there. They create a lot of questions. And many of these questions we're not going to be able to answer. We don't have a vaccine yet for fully effective for Ebola, for swine flu, or for any of the others. We don't have a specific treatment. But most of these conditions, they have patterns. They have patterns that they help us epidemiologically tackle them. And in preparation for this presentation, I could not separate my background. I grew up in Cuba, and I trained in pulmonary medicine in Cuba, and I work closely with epidemiologists in Cuba. And in Cuba, being a Caribbean island, all these mosquito-borne diseases are there. Mosquitoes are part of my family. We don't have, I grew up in a very tiny town, there's 700 people. We don't have air conditioning, we don't have sunscreen, EPA approved, we don't have any of that. We just trying to find ways and patterns to control this. And one thing that nobody can negate about the Cuban government is that they do an amazing job controlling transmission of this kind of disease and these problems. So how do they do it? So in preparation to this, I said, you know what, I'm going to try to replicate what the Cuban government usually do in these diseases. They try to find common patterns. These diseases are viral. We know that. They shake the economy. We know that. We know also that these diseases create a lot of panic. And we know that we can try to find ways to control the transmission. So that's what they do. They teach the population and they teach the healthcare professional to identify this single pattern. But the number one that they usually tackle, it is panic. All these diseases, they create fear in the population, and that is problematic. So panic is usually a big problem that in the Cuban healthcare system, they try to control right away. So how do they do it? They try to make it very simple. They try to educate the population in a very simple way, and they try to educate the healthcare professional that all the questions that you have about this, you're not going to be able to answer those questions to your patients, but you're going to be able to answer specific questions that will help them and help the entire community and the government face these epidemics and this problem. So how do they do this? So I put together, this is my Cuban Guero translating one of the mnemonics that they use back home, and is be ready. So what they do, they create mnemonics that they are simple to post everywhere, that the population can see them. So something like ready, you read about it, you understand about it. For us, the healthcare professional, you try to find expert opinion. They try to minimize, it's a control system, but they try to minimize the information that leaks out from many sources. We in America were victims of that. The internet is the Tower of Babel. You can pull out anything and everything and nothing makes sense. So we gotta go to the resources. We gotta go to the people that are doing the research. Here in America, we had the pleasure and the capacity to join the research from the CDC. So you look for those expert opinion. We act. We go. We learn. We try to apply this knowledge and educate our population. And we think about the disease. We need to know something about the disease, the symptoms, and always, we healthcare professionals back home, they tell us that we are in control. We're responsible of blocking the panic that any of these epidemics can generate. So let's dive into the ZIKA virus. It's a mosquito-borne disease that was first found about 50 years ago in the jungles of Uganda. And apparently the first human case was around 1952, and there's no report after that. Nobody knew about this until just last year when we have an outbreak in Brazil. Brazil has and the largest outbreak in the last 50 years. But why this is important? Well, the disease per se, people get infected from the virus. About 20% of the people just have the symptoms, or 20 to 30% of the people. But the biggest problem is this. There's a bunch of girls here, young people, and this mosquitoes has been linked to microcephaly. It's a birth defect that is affecting a humongous number of people in Brazil and many other places. Look at this. In Brazil, the annual average for the last 10 years, it was about 150 cases of microcephaly. Just in 2015, they have 3,550 with an increase about 2,000 cases in a year. So that is a humongous crisis. So what is microcephaly? Well, this is a healthcare conference. Most of these kids, they have the skull becomes smaller than the skull for a normal age and sex, and they carry a multitude of neurodevelopmental problems. So what are the most important symptoms? Again, it's kind of a viral disease, common viral disease. Most of the patients, they have fever, a micropapular rash. Less common, they're going to have arthralgia and conjunctivitis. But the transmission of the disease is a blood-borne disease. Mosquitoes is still the #1. We have a multitude of cases now reported of sexual transmission, blood transfusion, and placental. So in America, so just yesterday, the CDC released that we have reported about 395 cases of infected by the ZIKA virus. In my county, we have the largest number of cases. I'm in Broward. Between Broward and Miami, they have about 79 of those cases reported today. But the biggest concern that we have down there is about 6 to 7 young girls that they are pregnant, that they've been infected by the virus. So what's going to be the impact of this? We don't know. But it looks like the virus, like any other this mosquito-borne disease, the virus is really afraid of altitude, #1, and #2, they are really afraid of cold temperature. So the problem is really, really in the southern state. It's going to be for Texas, it's going to be for Louisiana, Georgia, and Florida primarily. Florida behave epidemiologically just like any other Caribbean country. It's an extension of Cuba and any of those countries. The only advantage is that we have air conditioning, and we have, well, there are many advantages, but we have means to protect and tackle this epidemic. So again, I'm going to swim back into the cycle of the virus and going back to my hometown. In Cuba, there is data that I didn't want to put in here, but there's data that we get every 4 to 7 years. We get an outbreak of yellow fever or chikungunya and so on. And the second thing, after educating the people, they go and control the transmission of the disease by tackling the cycle, which is controlling the mosquito primarily. The sexual transmission and placental and blood is going to be minimal. There are ways to test some of those, and it's going to be tackled by education. But they go very aggressive in controlling the transmission from the mosquitoes. So when I heard the other day that we are going to have a humongous amount of money coming, God willing, to tackle this problem, we don't have any reason why not to control any of this epidemic. One of the issues that I see coming from outside and getting into America that I see is the awareness and engagement of the population is not there. It's really hard to embrace the population and shake them with any of this situation to get involved in controlling any of this epidemic. So how do we go with the diagnosis? We got to have the history of traveling to one of these areas. Epidemiologic, again, there are people that are saying that Florida now is probably one of these Caribbean areas. So if you travel to Florida, you can be exposed to this. Hopefully, we'll be able to control the mosquitoes, as we said. The clinical symptoms, as we mentioned before, we cannot culture most of these viruses. PCR is really good, but within the first 3 to 4 days of having the symptoms. After that, like the yellow fever and chikungunya, is all about IgM serologists that they are becoming positive by the end of the first week. So again, this is the 2 types of mosquitoes responsible for this. As I told you, they're very afraid of coming to Washington. They're in the southern state. They don't like the cold temperature, and most likely the problem is going to be there. Treatment, we don't have a treatment. We have to go back to the prevention. Thank God that we have all this kind of stuff in here. So I cannot use long sleeves shirt back home because you will die of suffocation and heat. You have to use the EPA certified. That's what we recommend. And this is a very important point in here. You have to use it before putting any sunscreen. So most people do it all the way around. Avoiding traveling to high-risk area. This is another problem. Brazil now has the Olympics coming, and the impact in the economic will be incredible. So again, facts to know, microcephaly is the biggest concern that we have. Young ladies, young girls that are going to be pregnant, and they should consider when they travel to any of these areas, this risk. There is no vaccine available. Prevention and avoiding the mosquito bites is still the #1 thing that we should do. Mosquito bites occur mostly during the daytime. Again, they're afraid of the night, high altitude, and cold temperature. Mosquitoes also spread dengue and chikungunya in the Caribbean. We have all this kind of stuff. Again, they live with us. They're part of my family. And also prevent sexual transmission by using some kind of barriers. Again, remember, the fear is our responsibility to teach and educate people. We don't have all the answers, but we have some of the answers that can actually control the fear and help us control any of this epidemia. And I guess that's it. Thank you.